Alrighty, welcome everybody. Friendly reminder that we are recording. Thank you again for Jolene and Melanie from PCHS giving their Medicare presentation. We're going to go ahead and get started. The floor is yours.
Great. Good morning, everyone. My name is Jolynn, and I'm a navigator with Peninsula Community Health Services, as well as a SHIBA counselor that helps with Medicare.
And my name is Melanie, also a navigator and a SHIBA counselor.
And we are going to talk to you a little bit today about Medicare, open enrollment, and access to resources for people that you may come across that need some information. But we don't want to overwhelm you either, because there is a whole lot of information when it comes to Medicare. So we do have a PowerPoint, but we may skip over some of the slides because they have information that is more detailed than what we're needing to talk about today. And you're going to start, correct?
Yes.
Okay.
Let's get started. So we'll talk about the basics first. Okay. So first of all, we also work with the Washington State Insurance Commissioner's Office. We are called SHIBA, which stands for Statewide Health Insurance Benefits Advisors. We provide free and unbiased information. We do not sell anything. Okay. And we're going to give you an overview of what Medicare is all about, the 4 parts of Medicare, and what have you. And we counsel anybody. However, if we see people who are coming in affiliated with TRICARE, or they work for the school district, or was in the military, we always advise them to first contact their benefits administrator. That's the first thing that they need to do. And also people who are coming in first to join Medicare, we ask them to first start a Social Security account, which is the fastest way to do it if they want to sign up with Medicare. And we always encourage them to create an SSA.gov account. The second option is they can call and schedule the appointment, but again, the fastest way is for them to create an SSA.gov account. We also encourage anybody contacting Social Security or any insurance person to please make notes of the time, the date, and the person that you spoke with. So what is Medicare? Medicare is made available to people who reach the age of 65, but at the same time also, people on disability, they can get started on Medicare early on before age 65. Also with people with ESRD or ALS. It's also available to green card holders as long as they've been here in the United States for 5 continuous years. We are administered by CMS, which stands for Centers for Medicare and Medicaid Services. And again, like I mentioned earlier, the first step is for them to contact Social Security. So Medicare has 4 parts, A, B, C, and D. Part A pays for anything when you're admitted at the hospital. So when you look at letter A, it stands for admitted. And for B, it covers any outpatient services. It also includes your doctor's visits and your DME down the road if you need it. DME stands for durable medical equipment. Part D stands for the drug plan, and Part C is also known as Medicare Advantage. And we can talk more about this in a little while. So when a person gets started on Medicare, like I mentioned earlier, the first step is for them to get enrolled in Parts A and B. You have to be enrolled in Parts A and B before you can be enrolled or purchase a Medigap plan or Medicare Advantage, which is also known as Part C. If one person decides to purchase Medicare Supplement or Medigap, they have to be enrolled also in Part D, which is the drug plan, to avoid any penalties. Also, if one person decides to enroll in Part C or Medicare Advantage, they also have the option to choose between an HMO or a PPO. Part C and Part B only pays 80%. 20% is out of pocket. Now, when somebody gets into Medicare, in its initial enrollment period, they do have guaranteed issue rights to purchase Medigap. That means They are
in
not
my ear. I have
required.
one up in the middle office.
They are not
I'm gonna have
required to
more that I can
undergo
share
any
throughout the hospital.
health screening. And Medicare Supplement or Medigap also has a monthly premium attached to it. We can also talk about parts A and B. Like part B is typically free for those who have met their required 40 work credits. And for those who have not met that, there is a premium to part A. Part B always has a monthly premium for 2025. It's $185 per month. This year, this coming year, 2026, it will be increased. We believe it's going to be $206.50, but it will be finalized this fall. Same thing with Part D. Okay. Skip that. Okay, so this is just an overview of what's covered under Part A. Like I mentioned earlier, just remember Part A, admitted. So when you're admitted at the hospital. So like I mentioned earlier, Part B is pretty much free for most of us because we've worked at least 10 years and we've met the 40 work credits. Part B has a premium, and for 2026, we believe Part B annual or monthly premium will be $206.50. Again, that will be finalized this fall. We also talked about the 20% co-insurance co-pays, and what I failed to mention with Medigap, the 20% that is paid for or helped by Medigap, it helps pay for your co-payments, deductibles, and co-insurance after you meet the annual Part B deductible. This year, Part B annual deductible is $257. Next year, it will be up to $288. Again, final figures, we'll know it by this fall. So somebody who opts to get enrolled in original Medicare Parts A and B and chooses to buy Medigap and then also purchases standalone Part D, they have to purchase a separate dental, vision, or hearing. Unlike Part C or Medicare Advantage, a lot of these private insurance companies that sell Part C or Medicare Advantage also include other features such as your dental, vision, and hearing. So we talked about initial enrollment period. This starts 3 months before your birthday month. So for instance, if you're turning 65 in January, 3 months prior to the month of January and 3 months after your birthday month is what you call your initial enrollment period. That means you have guaranteed issue rights to purchase your Medigap or Medicare supplement, even if you have any pre-existing condition. Right now, we are getting into our open enrollment period, which actually starts tomorrow. It runs from October 15 to December 7. During this time, you have the option to not do anything if you're in Medicare Advantage. If you're happy with what you have, you can stick with it. It will just automatically renew. During this time, also, you have the option to explore what other plans are available to you. You can switch to a different Medicare Advantage plan, or you can switch back to original Medicare or vice versa. And you can also switch to a different Part D plan during this period. And we talked about the IEP earlier, so we can skip that. General enrollment period starts next year, January 1st. It runs through the 31st. These are the people who missed their initial enrollment period, and they do not qualify for a special enrollment period. Special enrollment period works for people who are 65 and are actively working and continue to have their employer's insurance. At some point, if, for instance, they decide to continue working up to age 67 or what have you, they have the option to delay enrollment in Part B. And once they decide to retire and their employer's insurance will terminate, then they can initiate or start their Part B enrollment period. And at that point, we always recommend for this beneficiaries to make sure that they complete 2 forms. And again, we don't have to deal with that because it includes other steps. But if you have questions later on, we can discuss it. Okay, so this is somebody who's getting into Medicare is automatically enrolled if you are already getting your Social Security benefits. Some people opt to get their Social Security benefits at age 62. If they are enrolled, then you do not need to initiate the enrollment in your Medicare Parts A and B, because Social Security will mail your red, white, and blue Medicare card automatically. The same is true for somebody who is on disability. Social Security knows after 2 years or 24 months, you transitioned from disability to Medicare. And we always let people know to watch out for any scams, especially during this open enrollment period. People who are turning 65, they'll get a lot of mails, junk mails from different insurance companies, selling them Medicare Advantage plans or what have you, even showing a lot of commercials on your television. We just want you to know, to be aware, there's a lot of scams. It's $1 billion scam going on right now. So we always let you know to please treat your Medicare cards as if it is your credit card. Don't take it with you all the time. Once it's scanned in your provider's office or the hospital, it is in their system. Want to talk about the drug plan, Julie?
Sure. So Part D Medicare drug coverage is not optional. Once you have A and B, you do need to enroll in a drug plan, and that is everything that you must have to avoid penalties. If you choose to get a Medicare Advantage plan, you can have a plan that has a drug plan rolled into it. So you do not have to choose a separate drug plan. We'll skip some of this because it's a lot of information, as I said. And this is talking again about Medigaps. Medigaps, or supplemental plans, are additional plans held by private insurance companies that people can purchase to cover the 20% that Medicare does not pay for. The downfall, as I mentioned, is they do cost. We cannot enroll people as SHIBA navigators and counselors into a Medigap. That is something they would have to do themselves, but we can provide them with the contact information and some details about those plans so that they can reach out to the Medigap insurers. Some people prefer the Medigaps because they say they travel well. They are taken wherever Medicare is accepted. Okay. Oh, they're talking about Medigaps and changes in 2020. There are a couple of Medigap plans, C and F, that you have to have turned 65 prior to January 1st of 2020 to enroll in. F is a great plan, and there's a lot of people that look at it, but they have to have been 65 prior to 2020 to get that, because it is a plan that's being phased out. Okay, I won't go into all the guaranteed issue rights and the time periods because that gets to be very confusing, but there are, with Medicare, a lot of enrollment periods. Okay, Medicare Advantage plans. People often look at them like an HMO, a health maintenance organization, something similar to Group Health or Kaiser. They do have an HMO or a PPO variety. HMO is Health Maintenance Organization. PPO is Preferred Provider Organization. With a preferred provider organization, you have a little more freedom to refer. You can go to doctors that accept that plan without a referral. With an HMO, you really have to have referrals for pretty much everything, and prior authorizations are often required. So people definitely have an opinion on what they prefer. Some of them don't want to think about it, just want to let their doctors deal with it and let them have those referrals managed by their providers and go wherever. Others want to stick with specific providers, so a PPO is sometimes a little better for them. Medicare Advantage, the benefit to it is there's often plans that have no monthly premium. So as far as affordability, it's a good thing for a lot of people who are low income. They also offer dental and vision and hearing all bundled into one. And they also sometimes offer rewards like fitness benefits, or where they'll get a discount for the Y or Planet Fitness. They also offer sometimes some cash benefits, like they'll give them cash on a card to put towards over-the-counter medications. So some people really see a benefit to that as well. Yes, and the interesting information about Medicare Advantage that people are always asking me is, how do they get paid? Medicare Advantage plans often have a $0 premium, meaning you're not paying extra for that plan. Well, they are paid $12,000 per year per patient that they accept to manage their Medicare. So they're getting paid, just not by the patient. Okay. Yeah, so as Melanie touched on, we are going into open enrollment for all Medicare for October 15th through December 7th. That there is a period for Medicare Advantage plan holders from January 1st to March 31st every year. They can make a change if they need to. So it's nice if you find that the plan you enrolled in is not going to work for you, you have that opportunity to make that change. All right, and paying for Medicare. We actually work with a lot of people who are low income, and there are lots of options for assistance in paying for certain parts of Medicare. So most beneficiaries, as Melanie touched on, have premium-free Part A based on their work history. There are people who make quite a bit of money that do have a premium attached to that. If you receive a Social Security benefit, it will be withheld from your Social Security check. For those that are not getting Social Security yet, they will pay their premium on a billing basis. Part D can also have a premium if you make over the specific amount on their threshold, and that's through IRMA is what we call it. You may hear about IRMA at some time. It really makes people worry, but that's based on making as an individual over $106,000 a year. And in our work, we don't meet very many individuals like that.
That is for single individuals.
Yes.
And for a couple, there's a different income threshold.
That's right.
And again, the numbers will change for 2026.
Yes. The insurance companies every year take advantage of this time to raise their rates. Okay. So Medicaid is an option for Medicare beneficiaries if they are financially eligible. So to get Medicaid, you don't do it through the standard practice of going through Apple Health Plan Finder like we do with some of our patients. When you have Medicare, you apply for a Medicare savings program through the Department of Social and Health Services. They determine where you fall based on your monthly income and what your level of savings will be. There are people who are what's called QMB, that is a qualified Medicare beneficiary. They get full Medicaid because they're under the financial threshold for that level. People who get full Medicaid have the option to get a plan with Medicare Advantage, which they will pay nothing really for their medical care. Most everything is a $0 copay for them. And then there is also 3 other levels for Medicare savings programs, and anyone who qualifies does not pay their Part B premium, and they automatically qualify for extra help from Social Security to pay for prescriptions. And that is something that is also able to be applied for separately because their financial threshold's a little bit different. So if people do not qualify for a Medicare savings program through DSHS, they can always apply through Social Security for help, at least with their prescription costs.
And when they apply through the SHS, even if they do not qualify, they're automatically, the application set automatically Social Security for extra help. So there's no extra step that you need to do to apply for extra help through Social Security. And also, like Jolene mentioned, QMB that helps pay for your Part B premium, together with Slim B and QI1 that pays for your Part B premium. And for those who qualify for full Medicaid, they can qualify for D-SNP. That means their Medicare is their primary insurance carrier. Medicaid becomes their secondary. For people who are in this category, they cannot be balance billed. Okay.
Okay, so these are premiums effective this year. These premiums may change. Seems like near the end of the year, every year we start getting new numbers. So individual monthly income limit for a Medicare savings program is $1,820. And for our QMB, it's around 14 something right now, isn't it? I believe so. I think it's around 14 something. So 1820, I believe, is the SLMB or the QI. Yeah. And the married couple, of course, it would be a little bit different based on their income. Extra help helps pay for prescription drug costs, and Social Security makes that determination. And as she said, some people automatically qualify. They get that if they are eligible for that Medicare savings program. And this is the threshold for extra help as of February of 2025. And again, that may change. Okay. Medicaid, as you probably know, is a federal state health insurance program for people who are low income, they have limited income and resources, or they have disabilities or are 65 and older and eligible for that Medicare savings program. And it is determined by Department of Social and Health Services. And if you have not ever assisted someone in applying for that kind of assistance, they do get very detailed in asking about income and assets. And so if they're going to go in person and apply, they're going to want to have copies of their bank statements and their identification and the like. They're going to want to know if they've sold a house or a car in the last 5 years. They really try to get down to the nitty-gritty. Okay, this is just going through the process of how to help someone apply for Medicaid if they have Medicare. So this is a little extra that we don't, I think, need to cover. Okay. Yeah, so something to know is patients who are on Apple Health, when Medicare is getting ready to start, they will often just get a notice that their Apple Health is ending. And people will kind of panic sometimes thinking, oh my gosh, I'm not going to have Apple Health anymore. Well, it's usually ending at the end of the month they turn 65. And so they have some time because they have that 3 months prior to their birthday month to get started. So they apply through Social Security and get their Medicare card and get going. All right. Won't talk about that, I don't think. Medicare fraud. This has been a big problem. They said something like $6 billion over the last 5-6 years has been lost to Medicare fraud. So as Melanie said, protect your Medicare card. Consider it like a Social Security card or your credit card. Don't share the numbers with anyone. Don't fall for phone scams. We are getting a lot of those at my house. I have elderly parents, and they're wanting to give them support hose or knee braces. They're saying Medicare is offering this for free. And it turns out that it is not from Medicare. It is an entity that is sending your provider a request, and then your provider signs off on it and Medicare gets billed. And that is an example of fraud. So if you have your Medicare set up and you know that you don't, shouldn't take calls like that, from people who are selling things, because Medicare won't do that. It's best just to say no thank you and hang up the phone. They also send out some bright pink or bright yellow postcards in the mail saying that they're from Medicare and that they're offering new opportunities for things. And if you read the fine print, it will say that they are not affiliated with government Medicare. And so they are not legitimate entities that you should be working with. So it's really important to make sure that if it doesn't feel right, you follow your gut and you report it. And you can always contact SHIBA to talk with someone if you're unsure. Okay, here's some important information for you all. This is a phone number to reach SHIBA, the 1-800 number. And it's also the website that will lead you to SHIBA information. And below that, there's a phone number for 1-800 Medicare. That is the legitimate Medicare where people can get assistance. They will, and we will as navigators, only ask for the Medicare ID number for the purposes of helping the patient. So for instance, we can help set up a Medicare.gov account. We will need to have their Medicare number to do that. So there are some occasions where the number will be requested, okay? But if you initiate that call to 1-800 Medicare, then you should know that it is the entity. If they call you and ask for that, that should never be shared because we don't know that's the legitimate Medicare. And then there's the website for socialsecurity.gov. I don't think that's correct though, is it?
SSA.gov.
It is SSA.gov. I don't believe this website is correct. And then the Washington Connection is for applying for assistance for DSHS. So that is where people can go apply for EBT benefits, cash benefits, as well as those Medicare savings programs. And then as always, they're always asking people if they're interested in learning about Medicare and they love working with people. We would love volunteers to do what we do and help people with understanding Medicare. It's very complex and it's very stressful, especially for our older population. And it's very rewarding to help people walk through the process and get the coverage they need without being pushed into something they're not comfortable with. All right. And then they do let people know that insurance.wa.gov is also a good option if you're looking for other types of insurance, homeowners, auto, life, and the like. All righty, and there is not an evaluation form, so we will skip this.
We can share the other.
Yeah, and I'm going to see if I can share this other. Okay. This one. Okay, hopefully everybody can see that. This is the site for the Office of the Insurance Commissioner of Washington State. And I just wanted to walk you through a way to get to the resources for SHIBA. I know that, for instance, we do SHIBA for Kitsap County, but throughout different counties, there are SHIBA representatives in all of Washington State. So I go, let's see, to Insurance Resources, and I go down to Medicare. And then if you go to How We Can Help You with Medicare, it says right here, how to contact SHIBA. You click Find a Volunteer in your area, and you will see this wonderful long list of people all over, or organizations all over that you can contact. And up here, you can make it a little simpler, and you can put in a zip code. And let's say, we'll do Kitsap. There it is. And there we are. And so it'll show a phone number here. This is the one to get to us. And you can leave a voicemail or you can email here as well, and they can send a message over what they're needing. It'll go to us. We get those emails daily, and we get the phone messages daily, and we attempt to call those patients to schedule appointments and the like, and help them however that we can. Okay.
Jolynn, could you share your screen again and just
Yes.
quickly show like the Clallam and Jefferson County folks, just so that they can.
Yeah.
I see you, Marky. I know. I was trying to do a shameless plug for you.
This one.
I can do a shameless plug for me.
Here we go. What is the zip for Clallam? Do we know?
98362.
98362?
Yeah. So I'm the SHIBA program manager for Clallam, Jefferson, Grays Harbor, and Pacific counties.
Okay.
And so I was going to put in the link for open enrollment. We have our schedule for our upcoming clinics.
Uh-huh.
And it's basically a link to our website for SHIBA, and so our Clallam and Jefferson clinics and a schedule for that. And then I've also got a link to the open enrollment toolkit and on there as well. So thank you guys so much for doing this presentation. It's a tough gig.
It's a whole lot of information, isn't it?
Navigating the Medicare and helping folks do that. So we are O3A, Olympic Area Agency on Aging. We are the ones who do that counseling here in our counties. So
Fantastic.
I was just gonna throw a link into the chat for that.
Yeah, that's great. And we actually were gonna show that Jumpstart toolkit as well.
Perfect.
Yeah, and go through it a little bit. It simplifies things for people so much. Very, very helpful. Yeah. Are we good? Can we switch to that now? Is that okay?
Go for it. That's great.
Perfect. Thank you. This is the Jumpstart toolkit. Okay, so on the Medicare page, again, this is the open enrollment page. And so if you go to insurance.wa.gov/Medicare OEP, it will take you right to this page. Talks about enrollment dates for the open enrollment period and how to get started. And as you scroll down, you're going to find all kinds of different information, Medicare's Plan Finder tool. Right? And then I passed it, didn't I? Jumpstart Kit. The Jumpstart Kit should be here. There it is. Find out how to get a free Medicare Open Enrollment Jumpstart Toolkit. Click on that and come down here, and it has the PDF so that we can walk through it with you. And here we go. So this toolkit comes like a folder, and we've had it put out into our local libraries and some of our senior centers. But if a beneficiary wants to get one, they can order one right online here through the Medicare website. And on the left side, it has this gigantic fold-out white envelope. And it's for people to put their mail, anything that they have questions about, possibly regarding open enrollment or making changes. Or for instance, Kaiser sent out a wonderful letter recently saying that one of their plans wasn't going to be available anymore, and people are panicking thinking Kaiser's not available anymore. So they can bring that information into a navigator to get some assistance. But then they also have some papers in there just to kind of simplify what to bring and what they should have and kind of explain what things are. So they can match their Medicare card with the red, white, and blue card. And then they can kind of figure out what they have as far as a Medicare Part D plan, that pharmacy plan, or if they have an employer plan, or if they've got something else, it kind of guides them to what they have and what's important to bring. And this is sideways, I know, but this is something they can write on. Are things changing? What are they concerned about? Questions that they may need to bring up, okay? And then their options. This explains their options, and they can check mark which plan they have now and get an idea if they want to change plans completely or if they want to stay in the same realm of things. And so this explains Medicare Part D and Medicaps. And then, of course, they have their little access to different things. You can get on through your phone or go to a website and find answers to questions there as well. So just a little kit to kind of hopefully make things easier that the Office of the Insurance Commissioner has taken on putting out this year, and hopefully it's helpful, and we're always trying to improve it more. So I just wanted to introduce that to everyone. And like I said, it's available at most public libraries now, and also at senior centers, or they can get it through this avenue through the website. All right, do you have anything to add?
No, again, just
Okay.
I know it could be overwhelming, but we're here to guide and help them navigate through their different options. And we do not, again, we do not sell anything. We do not represent any insurance company. Definitely, beneficiaries can get in touch with an insurance broker and insurance agent. Just be aware that insurance agents earn their commission by selling their particular product. So it's important, if they need to get in touch with somebody who is in the insurance business, it's good for them to connect with an insurance broker who has a plethora of other different insurance options for them. Okay.
Yeah, so if anyone has any questions, we're happy to answer questions. I know we moved through some information quite fast, so if you need to see something again, we can try and pull that up for you as well.
Let's open the floor up. Does anyone have any questions for the SHIBA team? See Diana's physical hand. There we go. Go ahead, Diana.
I have a client who's moved from out of state and has a Medicare plan. Does she need to change her plan right away since she's moved to a new state?
Well, if she is enrolled in a Medigap plan, Medigap works anywhere around the United States. She can carry it with her. She does, unlike Medicare Advantage, Medigap does not have what you call an open enrollment period. She can switch anytime during the year. Our suggestion is, if she does, if she would like to do that, I would encourage her to call the insurance company directly. We have a list of approved private insurance companies that are approved by CMS to sell in the Kitsap County area. And that's available also on the website under insurance.wa.gov, Medigap chart, wherein she can review those and see if she would like to switch. The telephone numbers for each insurance company is also indicated. She can contact them directly, and I would recommend once she's enrolled, and then that's when she can call the other Medigap insurance company and disenroll, so she doesn't have to pay, or pay twice in a given month.
Right.
Thank you.
You're welcome.
Anything else? So as far as navigation, we are available in Kitsap County. We know there's a lot of other navigators available elsewhere. We are happy to help anyone that needs assistance for as long as it takes. I've had people come meet with me 5-6 times before making a decision, and that's okay. So I know they feel a lot of pressure, but as long as they start, hopefully, prior to turning 65, and they have that window of time, it'll be okay. It's all figure outable.
Right. And if they want to review whatever options they have available to compare with what they have currently, we can certainly do that as well. So they know they're getting the right insurance for them that fits their needs.
And we've actually, oh, go ahead.
Oh, no, go for it. Go for it.
I was just going to say, I've actually had a few people come to me to get information that are honestly working with brokers because they have a friend who's a broker, or they've worked with a broker before, but they don't want to feel pushed into something. So they come to me or to Melanie to get information. So they're making an informed decision and don't feel like they're being persuaded to pick a plan they're not comfortable with. You can go ahead, Yvonne.
Well, I was just gonna close us out, so I wanted to give you space to.
We're good, no worries.
I'm super excited to have both of our SHIBA teams on. Margie, I didn't know that you're joining us. I didn't pay attention to the registration mainly. So I'm excited that everyone has been able to figure out who they can connect with no matter what county they work in. For those of you who are part of Olympic Connect, this will be added into Genius under the partner recordings. And then anyone who's not Olympic Connect related, OCH is working on adding all of our partner presentations to our websites, but this recording will be up by the end of the week. So if your peers weren't able to attend, that's totally fine. We'll get them caught up with this recording, but just want to thank everyone for their time and engagement. And you two were amazing, super informative.
Thank you for having us.
Thank you for having us.
SHIBA is hard, Medicare is hard, and so I commend you for the brain power you have every day to do it.
We're learning every day.
Marky, you have something?
No, other than, thanks ladies for doing the presentation. I know it is a difficult program and volunteers are key to keep it all rolling, and there is definitely a lot to learn, and every day is appropriate for
yes,
that.
it's always changing.
yes it is.
Thank you.
Thanks y'all for your time, and we'll see you next time. Okay, thanks everyone.
Appreciate it.